السلام عليكم أعزائي الطلبة، أتمنى أن تكونوا بخير وسلام. محاضرتنا اليوم بعنوان Trial Denture The Try-In Appointment by Dr. Ali.abdualrazaq. At first, we define the trial denture, a preliminary arrangement of artificial teeth that has been prepared for placement into the patient's mouth to evaluate aesthetics, phonetics, and maxillomandibular relationship. So we need to try the aesthetic and phonetic and the relation between upper and lower denture. Importance of the trial denture: it is the last opportunity to evaluate many of the previous steps already accomplished. So it is the final reversible step in complete denture manufacturing. They permit patient to assess the appearance of the denture, and also it will give the opportunity to identify and correct of any error before the denture is finished. So it is very important steps. It is the final and last steps before fabrication of final complete denture. The objective of this procedure: first, we verify the relation between upper and lower. Also, we check the vertical dimension, we check the centric relation, and we determine the position of teeth with the surrounding oral tissue and evaluate the aesthetic requirement. And also sometimes if we need further registration of protrusive and interocclusal records can be made. The aspect of the trying stage: we have two steps. At first, extraoral examination of the trial denture procedure, then intraoral examination inside patient's mouth. Let's start with the extraoral examination. As we know, the master cast should be in good shape and free from air bubbles, and the trial denture bases should check the following. First, we should check the borders of the denture: round borders, smooth surfaces, no sharp edges. Okay. Also, the border should be shaped to confirm the depth and width of the sulci of the sulcus. On the articulators, the mounted cast is checked for. Now, we should very concerned with this point at the trying appointment. Trying appointment, it is the fourth visit. Okay, at first primary, final visit, then the centric visit, then the trial visit, trying appointment. The trying appointment, at first we receive the articulator mounted with the cast, mounted on the articulator and with trial denture inside. So we should check it on the articulator for the relation, occlusal relation, for the vertical dimension. Also we should check the incisal pin, touch with the incisal table. Okay, we also moving of the articulator smoothly from centric to eccentric position. The trial denture pieces will lie properly on their cast and the teeth will meet in centric relation. This is all on articulator, not inside patient mouth. We should check the relation, the dimension, the incisal pin position in order to confirm that the laboratory will make its work in a well-formed fashion. Then, as you see here, the articulator, the upper and lower cast, the denture in a well-arranged manner. After that, the teeth should be in proper shade and shape. Also, elimination of any excess wax if is done to avoid the false teeth relationships. The relation of upper and lower teeth to the opposing ridges must be checked in case if there is any excessive relation of anterior teeth. It should be relieved in order to distribute the forces of the whole ridge, not concentrated on the anterior ridge, make more resorption. The trial denture assessment in the mouth. Now, after we confirm the extraoral, now we come to the intraoral examination. We take the denture, insert it inside the patient mouth, then we should check the following. First, we should check the physical retention, stability, extension of denture bases, relationship to the neutral zone. After that, the denture upper and lower will be assessed together in vertical dimension, centric relation, aesthetics, phonetics, and establishment of the posterior palatal seal area. Let's talk about the physical retention. It is noted the retention of the trial denture. Very important point here. You should know that the trial denture is less retention than the complete final denture. Why? Because there is absence of posterior palatal seal area for the upper arch, poor adaptation of the trial denture base to the tissue. So, the loss of the retention may be include absence of border seal resulting from under extension, inadequate width of the flange, ineffective seal of the posterior border, and poor fit to the denture base. The stability, it is tested by applying a pressure. Apply pressure in a tissue-ward direction with a ball of the index finger in the premolar area and molar region. Okay? Very important. You press on the premolar and you check the other side. There is a good stability for the denture. It will not move with this motion. Causes of instability: the warpage of the denture. The warpage of the denture, I mean the dimensional changes that occur during manufacturing of the denture base, make the dimension not well fitted on the base. So there will be warpage of the denture, make it move with this motion. Posterior teeth set buccal to the underlying alveolar ridge. Okay? Make the posterior teeth more buccally, so when you press it, there will be rotation around the ridges. Hard unrelieved area in the midline. Okay? In case of upper denture, the midline raphe should be relieved. If it's not relieved, it will act as a fulcrum. So when you press on the side, it will move on from the other side. Extension of the denture bases. The accuracy with which the denture borders conform to the depth and width of the sulci must be determined. So we should check that the trial denture, it will extend it well in the upper arch from hamular notch to the hamular notch in very good manner. Also, the lower denture should be covered the retromolar pad well. Relationship of the neutral zone. As we know, the neutral zone, as shown in the here, the teeth will be positioned between the tongue from the inside and the cheek from the outside. This is the neutral zone. In this zone, it is neutral forces from inside and outside, while if the teeth arranged more lingually or palatally, there will be dislodgement. The same thing will occur if we make it more buccally. So we prefer to make the teeth in the neutral zone. Assessment of denture together intraorally. This is very important. Now, after we complete each denture alone, we assess the denture together by place it inside the patient's mouth and ask the patient to close his mouth. At first, we check the vertical dimension. Very important to check it. We have many methods to check the vertical dimension. It started with the original method of 2 skin points on the upper and lower and make the dimensional method. Also, the upper lower tooth and gingival visibility is very important. If there is more tooth visible or not. Facial profile and support, very important. The relaxed facial posture is very important. There is no tension in the face. inter-arch space with breathing, swallowing, and speaking methods, and patient perception of jaw position. This is what I say before about making a ruler, 2 points, one on the nose, one on the chin, and make the measurement. The closest speaking space is one of the method. As we know, the S sound refer to a space called the closest speaking space. It is a space between the anterior teeth, about 1 millimeter of space during making an S sound. Occlusal vertical dimension. In case the occlusal vertical dimension is too small, so there is a wide separation between the upper and lower arch. As we know, the freeway space, it is the rest minus the occlusal vertical dimension. The rest minus the occlusal vertical dimension. The rest minus the occlusal vertical dimension, it will lead to the freeway space. So in case the freeway space is large, here it is corrected, so we have spaces between the teeth. So in this case, we have in patient mouth, we look that the vertical dimension is good, is not good, is too small. Occlusal vertical dimension mean there is a space between teeth. So in order to correct it, we place a wax between upper and lower arch, and to make the good thickness and the appropriate thickness in order to correct the occlusal vertical dimension. If the occlusal vertical dimension is too large, mean that the freeway space is very minimized. In the normal freeway space, about from 2 to 4 millimeter, about 3 millimeter. If it make it 2 millimeter, is very narrow freeway space. This is 2 millimeter, is not good for the patient. So in this case, we need to remove one of the arch teeth and replace it with a bitrim and recentric again. Evaluation of centric jaw relation. How to evaluate the centric now? We evaluate the vertical very well by the closest speaking space, by the tone of the muscle, okay, and by the measurement points of 2 points. Now, evaluation of the centric. The centric jaw relation means the horizontal relation between upper and lower denture base. Here, the patient will be guided into the centric relation, okay, and we check the relation between upper and lower. If the centric relation is coincide with centric occlusion, yani very important this step. There will be any error in centric relation will apparent here. Either the teeth will slide over each other, cusp to cusp relation, for example, there will be sliding to get maximal intercuspation, so the centric relation is not coincide with centric occlusion, so it needs to be corrected. Like in this slide, as you see the spaces between the teeth, the separation of the posterior teeth in centric relation. This represents in centric relation. So this centric relation is incorrect. Extraoral articulator method. Here we make the wax between upper and lower arch and ask the patient to close. If the vertical is good and the centric is bad, so there will be, this relation will be changed according to the mark of the upper arch. As you see here, the articulator, after taking the record from the patient's mouth, we take the record from the patient's mouth and make it on the cast and mount it to the articulator to make the new adjusted. For aesthetic evaluation, as you know, the anterior aesthetic zone is very important, so we should check the midline. The midline, it coincide intraoral midline with the extraoral midline of the face. Should be coincidence between them. The anterior plane, as you know, the amount of the teeth appeared. This step will be recorded in centric visit. How much of the wax will appear during smiling and at rest. At rest should be 2 mm. During smiling, only the incisor teeth should be exposed or seen. As you see here, the size, the form and shape of the teeth is very important to check it, of the anterior teeth, and how the facial support also is very important, lip support. As you see between the two pictures, how the lip support is very important for aesthetic. The position of the anterior teeth, of the upper anterior teeth, play a major role with the thickness of the flange. The amount of the teeth exposed is different between people and between ages, between man and women, or between also male and female, between young and adult, as you see in the picture. Also, we need an aesthetic, sometimes we need some disarrangement. As you know, the ideal arrangement is rarely occur in natural appearance, so sometimes we need slight shifting of the laterals, some difference in length in a little manner in order to get more naturality. The smile line, as you see here, the smile line of the face, the upper anterior teeth should follow the curvature of the lower lip. Is very important to get an aesthetic sense. And the buccal corridor. The buccal corridor, you should see this and this spaces. It is very important. We shouldn't make the tooth more buccally and close this corridor. Avoid cheek biting and uncomfortable dislodgement of the denture. Buccal corridor is very important. Evaluation of the phonetics. There are different sounds and different techniques for evaluation. For example, labiodental sound, fe and ve sound. In ve sound, the centrals will touch the line of the lower lip. It's called the wet line. The end of the wet line of the lower lip should touch gently in the fe or ve sound. This is need a good vertical dimension relation in order to achieve such. Also, the se, che sound, as we note, it's called the sibilant-like sound. The sibilants mean the teeth during pronunciation of these sounds. There is no touch between upper and lower teeth, anterior and posterior. Also, the bilabial sound, p and b and m sound, there is no touch between the teeth. So you need a good alignment and good vertical dimension to achieve a good pronunciation of such sounds. About the posterior palatal seal, it occurs, as we know, in the upper arch from the hamular notch here to the other hamular notch here. We should draw a line. This line by indelible pencil between the hard palate and the soft palate at the beginning of the soft palate, but it should no more posteriorly because it will be unmovable part. We should be immovable part. We should place it in the immovable part of the beginning of the soft palate. How to check we are in good location or not? We ask the patient to pronounce a sound. A sound. In a sound, the soft palate here will descend downward. So the line, our line, will be fixed and not movable during a sound. So you are in a good location. But you should be sure to not put it in the hard palate, because the hard palate is not flexible tissue. The pressure of the denture in the palatal seal region here will lead to trauma, while here it's a flexible tissue. It can be pressed a little bit to obtain the posterior palatal seal without any trauma. Patient's role in trial denture to record. As you know, the patient should be very satisfied with this result from each step, and also of the patients with his parents or any person, relative person, also should check it for happiness and satisfaction. The technician role, you should any step make it in the trial denture should be recorded well in order to the technician make it in the final denture. So it should replicate the registration, should do the recording according to the prosthetic norms, provide stable bases, very important stable bases here, ensure the balance occlusion technique, to have articulated cast appropriately, good articulation and mounting, and ensure waxwork is completed well. And thank you for your listening.